So, firstly, we're going to talk about two different types of urinary incontinence. So, the first one being stress, and the second one being urge. So, with stress incontinence, this involves involuntary loss of urine with physical exertion. So, this could be things like sneezing, coughing, laughing, but it could also be things such as changing position. So, if you're going from laying down to sitting up or sitting up to standing up. And the cause here is increased intra-abdominal pressure and also weak pelvic floor muscles, more specifically ones of our second layer. So here it's going to be compressor urethra, and then this urethrovaginal sphincter, which is right here, which last time we talked about the sphincter being almost like a ring sort of muscle, so it either compresses or relaxes and then either lets things in or out of the body. The second one is urge incontinence. So this is involuntary loss of urine associated with a sense of urgency. So this is like when you put your key in the door when you're coming home from work and you're trying to unlock it, but there's a sudden sense of urgency. You need to go to the bathroom and then you're unable to make it to the bathroom on time. So this here, the cause is abnormal bladder contractions. So the muscles of like an overactive bladder, which are the same muscles that we talked about here. So this one and then this one right here, they contract with enough force to override both of those muscles. Gripping of the pelvic floor can also lead to difficulty relaxing, so it could also lead to fecal incontinence as well. So when we're talking about how much we should drink in a day as far as fluid intake, we've already identified that you are a 130-pound woman. So ideally, you should be drinking half of your body weight in fluid ounces. So for you, that would be about 65 fluid ounces daily. So 1/3 of this value could be bladder irritants, which is roughly like 21 fluid ounces, and the rest should be water. And then, of course, you need to compensate for fluid loss, if you exercise, don't exercise. So as far as urinary irritants go, this could be like coffee, tea, any sort of carbonated drinks, spicy, tomato-based foods, dairy, chocolate, cold remedies like cough syrup, as well as alcohol. So when you feel that urge to use the restroom, you can use this little technique to sort of help you. So stop what you're doing, take a deep breath, and sit down if you're able to. Next, you need to contract your pelvic floor 3 to 5 times. So for a woman, the cue would be picking up a blueberry with your vagina, or if you're a male, it would be to bounce your penis. Once you do that, take another deep breath and then assess if you still need to go. And if you still need to go, then you can walk to the toilet, but don't run. And then if this urge comes again, then you can repeat this process. So switching now to bowel management. Fiber intake here is graded based on weight. So preferably it should be 0.5 kilograms or 0.5 grams per kilogram of body weight. So since we identified your weight is about 59 kilograms, so half of this would be 28 to 29 grams of fiber per day. Fluid intake is also really important for this. Most people think that when you have either urinary or fecal incontinence that you should decrease your fluid intake, but actually it's the opposite in order to facilitate either urination or defecation. So sometimes it might be beneficial to have time toileting to ensure that you're allowing your body ample opportunity to void or defecate. Another thing that you can try is a bowel massage. So you would start down here on the right lower side of your stomach. We're going to make small clockwise circles around your stomach, up, over, as well as down. And you can do this any time of the day, at night, before bed. It just helps to sort of get that defecation rolling. When you are going to the bathroom, here's a few tips in order to help with defecation. So there is this thing called the anorectal angle. And so we want this angle to be between 80 and 100 degrees roughly. And this helps to facilitate defecation without straining. So the first thing you need to do is relax. The second thing is we want to increase this angle as much as possible. So you want to squat and you want to keep your knees above your hips and making it easier to defecate. So there's this thing called a squatty potty. If your toilet is too high, you can find them on Amazon, but that just kind of helps with that angle. Ideally, you want a low toilet seat, so like a standard toilet. And then you want your feet flat on the floor in order to relax your inner thigh muscles. And then you can also make these 3 different vocalizations, what helps to kind of bear down with that pressure. So it could either be sh, grr, or z.